Thanks, Lindsay. Today we'll be joined by a very active customer of Dimensional Insight, Geminisa Solorzano-Cooper, who is Chief Revenue Cycle Officer and Director of Revenue Cycle Management at FHE. In her role at FHE, Geminisa oversees all business activities and operations and directs the daily processes of the Revenue Cycle Management team. Hi, Geminisa. It's great to see you again, and thanks for joining us today at DIUC.
Well, thank you, Julie, for having me.
Geminisa, can you describe the initial challenges that FHE faced regarding revenue cycle management before collaborating with Dimensional Insight?
Well, a couple of the challenges that we had lack of visibility in our current practice management billing system. Many of the functionalities like report analytics and reporting were all done manually. And that, was extremely time consuming, for my team and I to actually have to generate reports manually. The other challenges we had lack of transparency within our data. Oftentimes when we were, generated these reports manually, myself, the auditor, and my RCM analyst really had to take like a bunch of time, like 5, 6 hours, just analyzing the data just to make sure that everything crossed over correctly, that there were no errors in the data that we were reporting. So again, lack of transparency, lack of being able to review and generate reports was a big issue for FHE Health.
All right. How has working with Dimensional Insight improved your visibility on payer trends, or especially concerning denials and underpayments?
Well, I can honestly report that since we've contracted with Dimensional Insight, our automated process is now 93%. So just imagine our workflow previously was at 100%, where we actually had to do everything manually. Now, Dimensional Insight has basically customized our reporting tools, customized and built our workflow management tool within the DivePort portal. We have full visibility to our data and our AR. We have full automated workflows within our own internal department, within revenue cycle management, within our medical records department as well, and also with our patient financial services. So processes that were once manual are now fully automated.
So, some of the most notable features are the fully automated workflows for the medical record team and the patient financial services team. Can you detail how this affected the collaboration between the teams on your side?
Well, yes. Since we went live with Dimensional Insight, two very important workflow management was created for us, and one of them is the medical records request workflow. That particular workflow is an automated process which allows my revenue cycle management team to communicate and submit medical records requests directly to the medical records team. So traditionally, how that process works, my collector or myself will review a particular claim. And instead of sending an email notification to the medical records team, we're able to request the medical records chart audit electronically. That request is then done into DivePort. It goes onto a work list, and then the medical records team reviews that work list every day. And then they're able to see, which particular accounts are a priority. Once the request is successfully communicated within the portal, then that response goes back onto the work list, and then my team is able to fully submit that medical records request electronically to the payer. So that workflow process for medical records is a complete success for us. I just had a meeting with the medical records team, and they raved about the efficiency of the workflow management for medical records requests. The other workflow we have is the patient financial services. This particular department for FHE Health they are responsible for reaching out to the patients in regards to balances due, copay, deductible, and core insurance. Anytime a claim is processed by an insurance company, that electronic remittance advice is posted into our billing system. Dimensional Insight pulls in that payment data into the work list, and then from there, any balances that is due to the patient, it automatically flows over to the patient financial services work list, and that particular department is able to reach out to the patients to discuss any balances that is open. Again, a seamless process, 100% automated.
That's wonderful. From working in the past with you, I know that you and your team have gained great value from streamlining your data and workflow. What are some of the most substantial ROI figures you have seen so far?
Well, two very important points, return on investment that I've seen thus far, and we've only truly have we've been utilizing the tool since June 1st. So from June 1st up until now, our end user productivity has increased to 26%. We've met our cash goal 2 months in a row. And in addition to that, we've seen a tremendous amount of denials decrease since we went live with Dimensional Insight. And one of the reasons for the denials decrease, because now we have full transparency and visibility to how the claims are being adjudicated, what the trends are in terms of the denials, and actually able to work on the claims much quicker than what we were before. So again, the fact that we're able to report on the denials, I can generate a report by the root cause code. That code basically is an indication of how that claim was processed by the insurance company, which allows me to set priorities to work those particular claims, a functionality and a process that we did not have in the past.
Well, with all of these positive changes in place, what do you see as the next step for FHE in further leveraging Dimensional Insight software and even greater efficiency and outcomes?
Well, right now we're utilizing the platform solution for revenue cycle management, finance, medical records, and the patient financial services team. What I would like to see is that we utilize Dimensional Insight workflow management for not just the departments that I stated, but for company-wide. We have our admissions department, we have our utilization review, we have risk management. So there's so many different departments within FHE Health that I can definitely see this will be a benefit and a return on investment for those departments as well.
Well, that wraps up our session for today. Thank you for joining us at the IUC and sharing your team's data journey.
Oh, thank you so much, Julie.